The spinal injection is the way of conservative managing of the pain originating from the spinal pathology. That it means that people who have acute disc herniation may need injection to alleviate the pain so they can be more mobile, they can start physiotherapy and actually break the cycle of the pain. Or the people who have already warranted change in their spine and it's actually affecting with like outbursts of sciatic pain, to help them to ease the pain so they don't need to use so many oral painkillers. We all know that the oral painkillers also have the side effects, gastric side effects, bleeding, problem with the digestion, etc. The nerve root injection or perineural nerve root injection, it can ease and speed up much quicker because you're delivering the drug close to the origin of their pain and actually making that area numb. So people who have also the inflammatory changes in the facet joints, which we can detect on the MRI and the SPECT CT, they are quite good responder also on the treating the pain. And afterwards, if the pain reoccurs, we may offer them another option for treating their current symptoms. There are several different types of spinal injections. One for treating the low back pain in the way from the abnormal spinal joints, the facet joints, which we call medial branch block. You can, per NICE guidelines, you can only have 2 of those medial branch blocks for treating the pain originating from a facet joint in a 1 year time. But nevertheless, you also have another type of the injection, which is a perineural nerve root injection, which usually treats foraminal stenosis, acute disc herniation, lateral recess stenosis, when the nerve root is compressed and swollen, to help to ease with the swelling and alleviate the pain on more rapidly. The last option is called the epidural injection for treating the symptoms of spinal canal stenosis or diffuse radiculopathy, when we need to install much larger volume of the drug in your epidural space to try to ease the symptoms you are currently suffering. You may have acute outbursts of the pain immediately after injection, which can last for a few days, but usually how this fluid will dissolve in the space around your nerve root, that sensation will usually disappear. Immediately after the surgery, you may feel numbness or even slight weakness in some of the muscles of which the nerve root is innervating. This is due to acute depolarization of your nerve roots by the local anesthetic, but this is usually transitory. The risk of spinal injections are extremely low. We would say that something may go wrong in the way of nerve root injury with subsequent leg weakness, increasing the pain in the leg, or neurological damage. It's 1 to 30,000 to 1 to 50,000 cases, so it's extremely, extremely low. The injections are usually done as a day case procedure, so if you had the injection under the local anesthetic, you'll be able to go home and you can drive easily after that in the less than half an hour to 1 hour. If you go under sedation, you'll need to accompany with another person to drive you safely home, and usually can be discharged after 2 hours after you have fully recovered from sedative.